So my name is John Boss. I'm the Bureau Chief for the Bureau of Communicable Disease Control and Prevention with the Missouri Department of Health and Senior Services. Endemic is a term that's often used in public health that simply means the constant presence of a disease in a population. It's expected that COVID-19, or the virus that causes COVID-19, will continue to circulate to some degree or be present in our communities, and therefore would be considered endemic. However, it's important to note that this is not an end of COVID-19 or the pandemic, but simply a change, and as we could potentially see additional waves or future occurrence of the disease. It's not easy to predict what COVID-19 is going to do in the future, so we just have to be prepared and continue to monitor the disease activity and take appropriate precautions as necessary. Really, most of the common or routine illnesses that many of us have experienced growing up or as adults are endemic to this area. There are many examples that we can choose, but one is strep throat. Many of us have had strep throat, or our kids have had strep throat. It's caused by a bacteria that's known to circulate. It's not an uncommon bacteria, and occasionally routine cases of strep throat do occur. So the bacteria that causes strep throat is considered to be endemic. So that is an example of an endemic illness. However, it should be noted the word endemic does not indicate the disease if a disease is more or less severe. Some endemic diseases are really quite severe and can cause fatal illnesses, while other endemic diseases can be relatively mild. So the term does not reference the disease severity, rather just that it's present and can be found in our communities. A lot has changed since the beginning of the pandemic. We now have many tools that we did not have before. We have vaccinations, we have tests, we have treatments. In addition, much of the population have some level of immunity. Many of us are vaccinated or have previously had COVID, so we have some level of immunity that, all of those tools combined have hopefully helped reduce the severity of illnesses moving forward. But again, with that said, it is important that we continue to monitor and conduct surveillance for COVID-19 and monitor for increasing trends or changes that could indicate some concerns that, again, so that appropriate control measures can be implemented and we can take the measures to help ensure that we stay safe. While we hope the current lower levels of COVID-19 activity continue, and we still must be able to identify increasing trends. The virus that causes COVID-19 is constantly changing, so it's certainly possible that those changes could result in additional waves or surges of the disease, and so that's something that we will have to continue to monitor and be prepared for moving forward. So as we make this transition to more of an endemic approach, it does not exclude the potential that we could see additional surges or waves of COVID-19 moving forward. And therefore, we just need to continue to be prepared and to monitor activity levels and take appropriate precautions as needed, as evidenced by that surveillance data moving forward. We have learned a lot over the past 2 years in responding to COVID-19. That was a new virus to all of us, and over the years we've learned, as well as we have many tools now that we haven't had before. We have vaccines, we have tests. We've learned a lot about how the virus is spread, the illness that's caused by COVID-19 and the virus that causes it, and we've learned a lot in how to prevent the spread of COVID-19. So we have learned a lot over the last 2 years, and we will continue to learn as we move forward. It is difficult to predict what the future holds in regards to SARS-CoV-2 and the virus that causes COVID-19 and changes that may arise and future waves. So we still do have a lot to learn, but we certainly have learned a lot over the past 2 years, and we're in a much better place now than we were before with the tools that we now have available and all that we have learned to better help protect ourselves from the threat of COVID-19.